شباب المسلمين إخوان المؤمنين رجال الصالحين.
My name is Dr. Sanni AbdulQuadri, and I'm a medical doctor and a surgeon in training. Inshallah, I've been told to talk about peptic ulcer disease and how it affects us as Muslims, especially during the Ramadan fasting. I hope I can do justice to the medical part of this topic, which is the peptic ulcer disease and its management. Well, what do we call peptic ulcer disease? It is actually a condition in which an ulcer is formed in the stomach and in the first part of our intestine that we call duodenum. In a layman term, it's a condition in which there's a wound, in the stomach and the first part of our intestine. And so basically, there are two types of it. There is the gastric ulcer. The gastric ulcer is the one in which an ulcer is in the stomach, and there's also the duodenal ulcer. The duodenal ulcer is the one we colloquially call the peptic ulcer, and that is when the ulcer is in the duodenum. That's the first part of our intestine. How do we recognize people who have these conditions? For this category of people, to recognize peptic ulcer disease, the person in question usually complains of pain in the upper part of their tummy. Upper and the central part of the tummy. Yes, that's a better way to put it. Upper and central part of the tummy. And they may have other conditions like feeling nauseated. They may also have this burning sensation along their throat. They may also pass dark colored stool, and they may feel bloated. Now, usually this pain usually occur more after fasting or after taking some spicy food. So it's like the edge of his sword, which is quite sharp. So there's a set of ulcer that occurs after prolonged fasting, and then there's the other edge of the sword, in which after taking food, supposed food, spicy food triggers it. So basically, that is just what this is. Now, when you have people around you having this kind of condition, or you have these symptoms that I've just highlighted, it is important for you to go to a medical professional to assess you, because it is so easy. A lot of people actually know the symptoms of this condition, and as such, they tend to self-medicate, maybe because of financial implication of this. But it is important for you to seek medical advice and attention so that you can be properly investigated and treated, because this peptic ulcer disease can get complicated if it is not properly managed. And the only way to confirm that one has peptic ulcer disease is to do a camera test, which we call endoscopy. It is actually a test in which one will put a tiny flexible tube through the mouth, which passes through the esophagus. So it allows us to outline the esophagus, the stomach, and the first part of the intestine that I mentioned. So that's the only way to confirm that this person has a peptic ulcer disease. And apart from this, it also gives us the opportunity of picking parts of your stomach, for testing. So again, when you have people around you having this condition, it is important for you to seek medical attention so that you can be properly investigated and treated. Because the treatment for peptic ulcer disease is in two ways. depending on the stage at which the individual is seeing the medical doctor. But basically, there are two ways in treating these conditions. One way is what we call the medical management, in which we give medications that will help suppress the symptoms of this ulcer. This is where a lot of people tend to use self-medications. And the other part of treating peptic ulcer disease is the surgical intervention. This is where the surgeons usually come into play. That is where we tend to be relevant in the management of peptic ulcer disease, in which we carry out surgery for them. So basically, you need, if the person is coming without symptoms of complications, which could be that the person is passing a dark colored stool, or the person is vomiting blood. At that point, medical management can actually take care of it. For the surgical care is usually given to people who are coming down with complications of peptic ulcer disease, and this include those whose ulcer are perforated or those whose ulcer are bleeding. So, for those whose ulcer are perforated, we usually have the surgical intervention to take care of it. So I just hope that this short video can actually has given us a little overview as to what peptic ulcer disease is. But of importance is for us to take care of the symptoms and seek medical attention as soon as possible, because it can actually complicate and it increases one's morbidity. Morbidity means that it increases one's level of sickness and the prognosis of these conditions. I hope I'm able to give a little, expose into what peptic ulcer disease is. Thank you so much for your time. Assalamu alaikum wa rahmatullahi wa barakatuh.